As COVID-19 has been with us for more than 2 years, many of us are hopeful that the pandemic will end soon. However, the arrival of the new Delta and Omicron variants make us doubt if the pandemic will end at all. To predict how COVID-19 pandemic may end, we can learn some valuable lessons from the 1918 influenza pandemic, which is also known as Spanish flu. This pandemic is now believed to be originated from the United States and consists of 4 waves. In the first wave, patients showed mild symptoms with normal mortality rate. Most of the sick patients were elderly, while younger people recovered easily. As World War I happened in this period, no countries implemented quarantines, thus allowing it to spread with the movement of troops. As the uncontained viruses mutated naturally, several variants appear. Some of these variants caused mild symptoms while others were more deadly. As the war continued, soldiers infected by the mild variant were sent to the battlefield and many were lost in the battle. Whereas, soldiers infected by the deadly variants were kept in the hospitals as they were too sick to fight. This variant spreaded in the overcrowded hospital and subsequently transmitted to the community. This situation created a naturally selection process that preferred the deadly variants and phased out the mild variants. Hence, a second wave of outbreak occurred that was much more deadly and targeted young adults rather than elderly. Within 3 months, millions of deaths were recorded in multiple countries. For example, estimated 20 million deaths had happened in India alone. Due to this, some countries had started quarantines and successfully bring the virus under control. As the pandemic started to subside, some countries had lifted their quarantine and this led to the third wave. In general, this wave was less severe than the second wave but was still much more deadly than the first wave. In the fourth wave, the disease had slowly become an endemic where only isolated areas recorded high death rates. Finally, in 1920 the virus had evolved and its symptoms were just like ordinary seasonal flu. So, what do we learn from the 1918 pandemic? Firstly, it was proven that quarantine, banning of mass gathering and wearing face mask are highly effective in reducing death rate. However, these measures should be imposed as early as possible and not being lifted prematurely. Besides, resistance to social distancing, face mask and other public health management methods is common and unavoidable, as exemplified by the Anti-Mask League of San Francisco. Thirdly, overwhelmed healthcare facilities such as overcrowded hospitals will nurture the virus. Hence, reducing infection rate and the number of severe cases that require hospitalization are essential to avoid deadly variants from becoming dominant. Lastly, when the pandemic is about to end, the dominant variants should become milder even though still highly infectious. This will allow unvaccinated people to have a chance to obtain infection-acquired immunity. In comparison to the influenza pandemic, we are fortunate that vaccines are widely available for COVID-19. The vaccines used for the 1918 influenza pandemic can only help with secondary infections. However, the vaccines used for COVID-19 are highly effective, especially in terms of reducing the number of serious cases. Even for the Omicron variants that can reduce the effectiveness of vaccines from 81% to 57%, a single booster dose will be able to restore the effectiveness to 90%. In short, vaccination and boosters allows us to build immunity in a safe manner compared to obtaining immunity via infection. With the mass vaccination programs and infection-acquired immunity from Omicron, we are getting close to the end of the pandemic. If you enjoy the information that we share, please like this video and subscribe to our channel so that you will be notified when our next video is ready. By giving us positive feedback, you will help to promote our videos so that more people will be able to receive correct information regarding COVID-19 and other health analytics. If you are interested in drugs and diseases, this is a course that we recommend. For more information, please scan the QR code or refer to the link in description.